All right, guys, so I'm here with Penelope. I'm about to go see Sura, who's one of my patients for about 2.5 years, and I always get a little bit nervous. She's here for her lymphoma recheck, and I always get nervous. Is this a visit when she's gonna relapse? So I'm gonna go see her, and then we'll see how she's doing, and then talk about dogs with lymphoma. Okay, let's go see.
Not you, Penelope. You can't come. You can't come. No, you can't. No, you gotta go to your cage. You gotta go to your cage. Okay, okay.
How are you, Sura? All right, ready for your exam? All right. So this video is going to be about when dogs relapse when they have lymphoma. We spent a lot of time talking about their first diagnosis and the different tests that they do, but I wanted to focus a little bit more on what happens when they come out of remission and why they come out of remission. And the reason I'm doing this is today I'm seeing Sura, which is definitely a dog that has broken a lot of rules when it comes to lymphoma. And I love when my patients break the rules and, as I say, make a liar out of me in a good way, because that means they're living longer and they're statistics busters. They're busting the statistics and doing better. Hi, Sura. You're here for your lymphoma recheck, and you're still in remission, baby girl. Woo-hoo! So let's do a quick overview. What is lymphoma? Lymphoma is cancer of the immune system, cancer of the lymphoid cells, so some of our immune system cells. And in dogs, usually means that they have multiple big lymph nodes, usually under their jaw, in front of their shoulders, behind their knees. But these cells circulate, and they get in the liver and the spleen and internal lymph nodes as well. Chemotherapy is the treatment of choice. Can't cut this cancer out. So what's really important is rapid diagnosis. And again, we're going to focus on what happens when they relapse. But in general, you want to get a diagnosis, and you can watch some of my other videos, and we'll put the links below of what tests we do and the different treats. But different treats. We always give treats.
You want this cookie? Hey, baby. Sorry,
Tell me you're picky. I don't believe it.
Oh.
But the different treatments that we have. But what I want to focus on today is what we do when a dog comes out of remission. So let's use Sura as an example. She's a really good example. So she was diagnosed, she went on, quote unquote, the best chemotherapy protocol, a CHOP multi-agent chemotherapy protocol. CHOP is an abbreviation and an acronym for the different drugs in the protocol, and they cycle through them. They get all of the drugs over about 5 months. Most dogs will be in remission for about 4 or 5 months after finishing the 5-month chemotherapy protocol. So their first remission, including their time on chemo, is about 10 months. That's when the average. That is the dog in the middle. There are some dogs that first remission is going to be 2 years, and there are some dogs that they're not going to go in remission or they're going to relapse while on chemo. But on average, just like Sura, she was really average to start. She relapsed after being off chemo at 4 months, 9 months after her original diagnosis. So I told her family the best thing to do, because she had been off chemo, that standard time is to go back on the CHOP multi-agent chemotherapy protocol. Let's stop for a second. What if she had relapsed 1 month later, at her first 1 month recheck after finishing lymphoma? Would have I recommended going back on the CHOP multi-agent chemotherapy protocol? Nope. If they don't at least get that 4 months of being off chemotherapy, in my opinion, the CHOP chemotherapy protocol failed them, because they didn't get that at least 4 months of off chemotherapy in remission. So if they relapse a month or 6 weeks or 8 weeks after finishing the CHOP multi-agent chemotherapy protocol, not going to recommend. I'm going to recommend they go on a different protocol, a maintenance protocol. Those dogs, in my opinion, usually end up on some sort of chronic maintenance chemotherapy indefinitely. Okay, but what about Sura? So she relapsed, and I said the best thing for her to do is go back on CHOP. It's really overwhelming, guys, because, it's going back to weekly chemo, and it's really, really expensive. Why is it the best? In general, the overall guidelines, and I mentioned this earlier, is that 50% of dogs will achieve a second remission, and usually it's half the length of the first one. But if they go back on the CHOP protocol, it's higher. Up to 90% or more will go back into remission. So that's what her family elected to do. She went back into remission. She finished her chemo. I was really worried that she was going to relapse around the time that she's finished chemo. She's been off chemo for 14 months. So with her 2 rounds of CHOP chemotherapy, she's been, out 2.5 years. So that's great. I'm so proud of you. Your second remission being longer than your first. You guys happy?
Oh, yeah.
Yes, ma'am.
Again, let's back up for a minute. Let's go over the general overview of lymphoma. With no treatment, usually a month, very rapidly progressive. If you just do steroids in the beginning, in general, 2 to 3 months. CHOP, multi-agent chemotherapy, average first remission we talk about is usually about 10 months, and the median survival time is about 13 to 14 months. Again, there will always be ranges on both ends of that, guys, and I'm always happy when they're over there near, near where Sarah is, and we hope that she continues to bust those statistics and do better. Okay, so let's talk about the other 2 options before we wrap this up. What if they didn't want to go back on, and why do we recommend CHOP? So there are other Plan B and Plan C protocols that instead of going back on CHOP that we are going to do at the time of doing this video. The ones that I'm really in favor with is Tanovea, which is a new lymphoma drug. We'll put some links below where I talk a little bit about that. Sometimes I'll alternate that with doxorubicin, depending. Usually they get 4 doxos in the initial CHOP. They can get 2 more. So we can alternate it with Tanovea or oral Lomustine. One of the things that we tend to see with most of the rescue protocols, that the remission rates are much lower and their survival times are shorter. So just things to consider and talk about with your oncologist or your veterinarian when they relapse. So I like oral Lomustine, Tanovea. The MOP, Mustergen protocol, is another really good protocol. Definitely, it's a multi-agent protocol that you can talk to your oncologist about. So those are some of my favorite protocols, my favorite rescue protocols. Again, if a dog like Sir had relapsed right after finishing chemo, before that 4-month period, I would be going to some of those protocols as well. So that is sort of the gist. But I think Sir is a really good example, guys, that, statistics never predict the individual. And when I told her owners that her second remission would likely be shorter than her first, they trusted me. And it's not that I don't know what I'm talking about, but cancer is really hard to predict. So again, it's really worth treating. And look at her, she's doing really, really great. So I'm super excited with how she's doing. I hope you found that helpful. Oh, we're not done. Come back. Come back. What did I forget to tell you? So why do they relapse? And this is a good question because someone asked me this earlier last week when I was talking about lymphoma, like, why do we have to give so many doses of chemo? So when we're going through chemotherapy, we don't usually cure it. There's usually some microscopic cells that are still, so when a pet comes in and I feel their lymph nodes and I say they're in remission, there's often still undetectable microscopic cells there. And at some point, those cells start to grow back and divide. And the other big issue is they get resistant to chemotherapy. So that's why we want to go back to CHOP. We want to see if we can still kill them with the same stuff that we used before we use our new arsenal. So again, it's survival of the fittest. We usually kill the wimpiest lymphoma cells, and then the strongest ones divide and they figure out mechanisms to be resistant to the chemotherapy. So that is the reason that they tend to relapse. Some of the other reasons that they'll relapse is not getting chemo frequently enough and not getting a high enough dose. So that's why, as an oncologist, we don't want to lower the dose, if they have a side effect without really considering how much we're lowering it. And I will always try to do things like, can I add preventative medications and maybe not try to lower the dose? So lots of things to think about behind the scenes when you're dropping your pet off for chemotherapy, but we're on your side. We want to kick cancer's butt. Hopefully you found this helpful. Definitely, watch the other videos on lymphoma. And if you have any questions, put them in the comments. I'll do my best to answer them as soon as I can. And as always, thanks for coming. Please don't forget to subscribe. And if you have a friend or a family member whose pet is going through lymphoma and you think that this is going to be helpful, please definitely share. Thanks so much, guys. Have a great one.